good sign when no one says good morning back? I feel like that's a bad sign. Hi, Cherry.
Nobody wants to get off mute there to say good morning back, but good morning.
Thank you. Good morning, Mayor.
Good morning, Amelia. Good morning.
Good morning, everybody.
Morning.
Hey, Tim. Long time no see.
Okay, well, we have a full agenda today because I actually forgot about two things that were supposed to be on the agenda, so I need to add those in as we review. Ray Byrne is going to talk to us about the business technical advice as a follow-up from last week's conversation. And Lindia, as incident commander, is off for a couple of days. So her deputy, Tiffany Turner, is going to do a quick report as well. So did anyone have anything else they would like to add into the agenda? Okay, so what I'm going to do first is have Steve talk with us about our numbers.
All right. Good morning, everybody. As I think everybody knows, the cases continue to rise. For the week of November 22nd through 28th, we had 2,408 new cases. That tops the 1,672 the previous week, putting our daily average up to 344, where it was 239 the previous week. Our 2-week total, that's November 15th through 28th, was 4,073, putting our rate at 790 per 100,000 residents. It's a little bit over 800 right now. The prior week was the prior 2 weeks was about 3,164. As far as who is getting COVID, it's about the same as far as age groups go. The 20 to 29-year-olds seem to drive it, as well as the 30 and 39-year-olds. That's 23 and 18% respectively. Hospitalizations are up. We had 72 new Spokane County residents hospitalized last week. There were 62 the prior week. Currently hospitalized, there are 111 individuals, 83 of which are Spokane residents. Unfortunately, we had a large increase in deaths. The prior week, we had 20 new deaths, an individual in their 40s, 2 individuals in their 50s, 4 in their 60s, 7 in their 70s, 3 in their 80s, and 3 90 or above. There were 9 new deaths the prior week. Our testing, it's staying strong. It's still increasing a little bit. The average number of individuals tested in the last week was 1,285. That's up by just about 15. Unfortunately, our positivity rate is also increasing at 22.4%. It was 19.1% the prior week. For the healthcare system readiness, the percent of adult staffed beds occupied by patients is at 58.9%, and that is meeting our goal is 59% last week. Licensed beds occupied by suspected and confirmed COVID-19 cases is at 115, which means our percent of staff beds occupied by COVID-19 patients is at 10.6%, which is kind of getting in that concerning area. Case and contact metrics, we're really just going with cases now because of the large increase in volume. We reached 1,017 individuals last week, which seems to be about our limit. For individuals within SRHD, that was 64% of cases reached within 24 hours. Care coordination continues to see increased demand. To date, they have seen 1,161 households. Currently, they have 212 open cases. They closed 49 last week. The trends for service needs, PPE and cleaning supplies, food, medical assistance, and financial assistance. At our isolation facilities are 2. The census as of 3:30 p.m. last night. At our hotel, there was 10, so that's about 25% of occupancy. And at the Immaculate Retreat Center, the census was 31, which is about 62%. Ray's going to discuss it a little bit more, but for our business technical advisors, To date, they have done 3,513 consultations. Last week, they completed 364. An increase to 250.
Steve, you're cutting out.
Food security update this morning. A little bit behind what we said.
Steve, we can hear you.
There were 730 new applicants for food security. See if I can close this out. The 730 by turning up. Is that all right? We can try.
You're still
right
breaking up, Steve.
Yeah, it's still breaking up.
We lost you after the business technical advisor consultations up to date of 3,000 plus. Then the rest of it didn't come through.
And if you're on and you're not speaking, if you could mute, sometimes that helps keep the flow going.
Are we having any better luck hearing me right now?
Yes, that was clear. Yes.
So jumping to food security, applications for food assistance increased the prior week to 732, as well as food distribution jumped up for the holidays to about 572,000 pounds distributed by Second Harvest. Childcare remains pretty steady with no increases or decreases in vacancies. For unemployment insurance claims, as expected, there was about a doubling of claims. The week of November 15th through 21st, we saw 2,507 new claims for insurance assistance or unemployment assistance. The industries most impacted were food services and drinking places, and that was the primary group with 892 new applications. Specialty contractors had 152, and administrative and support services at 125. Finally, for our high-risk populations, the number of outbreaks in long-term care facilities is at 59. There are 59 over time total. There are 29 that are currently active, which is an increase of one facility last week. And that brokenly concludes my report.
Okay, questions for Steve? Okay, I'm not seeing any questions there. I know that the data went out to everyone in the packet for the if you look in your Outlook calendar invite, you can see all the data there. And as always, if anyone has questions, we're happy to help with those. So last week, Dr. Velasquez joined us, but he had camera issues. But this week we can see him, and he's here. He's been at the health district now for a couple of weeks as our interim health officer. So wanted to give him an opportunity to say anything, or if anyone has questions specifically for the interim health officer, please ask those now.
Thanks, Amelia. Good morning, everybody. I hope everybody had a good Thanksgiving. We did some Zooming, which is a new verb that we're all getting used to. So I hope everybody had a really good holiday weekend. As you can tell by Steve's numbers, things are a little bit complicated nowadays, but I'm the eternal optimist, so I know we'll get through this. I can tell you that we've been spending, if you just listen to the numbers, a fair amount of time with our healthcare partners, particularly Amelia and I, keeping track of service capabilities just to make sure that we can meet the needs of the community. We've also been spending a fair amount of time with school districts, businesses, events, higher education, the higher education athletics. We've been working very closely with the SAGs. As you know, they were on the road and we were in communication with them. We deployed antigen testing in high-risk facilities to make immediate or real-time disposition, which I think is a great tool that will help us going forward. And the team continues to work very closely with the various agencies on the vaccine distribution, as we are all looking forward to distribution at some point in the near future. So that's a high level. There's about we participate in so many activities that it's hard to recount them all, but I just wanted to give you a little bit of a high level last couple of weeks. And we've had the opportunity also to meet with many of you in a variety of forums, as well as spend some time with some of the community groups that are trying to assist in various areas such as testing. We're looking forward to Chas opening the testing facility up in the arena on the 6th. So I'm going to stop here and see if anybody has any specific questions that I'll be happy to answer. So after waiting the 10 seconds, did I hear a question? If not, I do appreciate everybody's support. It's the team here appreciates it. They're working hard, as are you, and we'll continue to do that going forward. If you think of anything else, you can send me a message on the chat box and be happy to answer. Have a great day, everybody.
Thank you, Dr. Velasquez. I now want to introduce, we have a special speaker today, and someone that we also often see on these calls, Tim Hinkle, who's been attending the meetings even when we were stood up as the EOC, who's the CEO of the United Way. He is on here today, along with Andre, and Andre is going to talk to us a little bit about the updated ALICE report that he has been working on with United Way. And when United Way reached out to us, this is something at the health district that we look at in terms of equity, because socioeconomics plays such a huge role in that. We also know with our care coordination and seeing the increased needs that some families are having, and the unemployment numbers changing consistently right now, kind of up and down. We thought this would be a good report for all of you to hear as community leaders on where we see anticipated socioeconomic issues continuing to occur. So I will segue it over to Tim and Andre. Thank you for being with us this morning, and you're free to start presenting. Tim, I think you're muted.
Can't hear you, Tim.
Okay, now can you hear me? Oh my God. Okay, now can you hear me? I'm sorry. I'm having to listen on my phone, and so at any rate, Andre will do this presentation. I just know that he'll share this with you, but very quickly, this is a study that is done by United Ways across the region. We share this in many ways with other organizations, and so we're very happy to provide this to you, but we also use it on our own work. And so, as I think Amelia set it up, is that it really does give you some perspective on looking at the impact on people's lives and their financial stability, and one of the goals that all of us share. So, Andre, I'm going to turn it over to you, let you walk through it, and we're more than happy to answer questions as this goes on, or at the very end of the presentation. So, Andre, it's all yours.
Good morning, everyone. So I will make an attempt to share the screen. Let's see if this will work.
Anne can give you that permission, Andre. She just has to give you that. She can do that.
Okay, I am still not able to share the screen.
I just made you presenter. You should be able to share now.
Okay, so I'm on both computer and phone, so there should be, so the screen is the one I have video should be the one sharing the screen.
Do you see the request now?
Yes, one. Okay. Let's see. Okay. Okay, so it seems like I need to rejoin, and now I should be able to share the screen. I apologize about that. Okay. Okay, I think you might need to make to give me permission again to share the screen.
Do you see the invite?
Yeah, it's having some issues here. Let's see. Okay, share. Can you see the screen now?
Yes.
Okay, wonderful. Sorry about that. Okay. All right, so let me minimize this. Okay, so today I would like to talk to you about a report, ALICE, which is a report on financial hardship study. And so this report, it provides framework, language, statistics, and tools to measure and understand the population in our communities that are struggling. And it is meant to challenge the perception who is struggling in our communities. This report can be used to more accurately identify the need, inform the policy, and drive innovation. And so ALICE, what does it stand for? ALICE is an acronym for Asset Limited. So households that have no safety in times of crisis. And that could be as simple as, going to work and the car doesn't start, needs to change a battery, which is a good $150. In those times of crisis, which we are living in a much bigger crisis right now, no safety net. Income constraint is that households do not have enough to afford basic household necessities. And I will talk about what is that, how is that defined by the ALICE report. Employed. So these households are working yet financially at risk. And examples of ALICE workers could be cashiers, nursing assistants, servers, childcare providers. And at the end of the day, what I want you to think about that ALICE households, they are contributing to our community. They are making things work. In this year, we talked about essential workers. Well, some of those essential workers, or maybe most of them, are ALICE households contributing to our economy. So I want you to think about that ALICE households it's about respect to these households in our communities, and also at the same time gaining a better understanding of what are the challenges that they're facing every day, because they are making difficult choices. The quote that I like, it goes like this: the mental energy that goes into figuring out how to make it all work is incredible. There's so much stress involved in looking at every dollar. And it is about trade-offs every day that Alice households need to make. And before I continue further on, I did want to just provide a brief refresher about the history of the official poverty measure, because I'm sure all of us know about it. And what is surprising about it is how is the official measure determined? So the actual measure was established in 1963 by the Social Security Administration, and what it does, it basically multiplies 3 times of cost of minimally nutritious food diet in 1963 and adjusts for today's prices. So it does take the federal poverty level, it does adjust for inflation, but the basis of poverty, of 100% poverty, is that of 1963, taking the minimally nutritious food diet, multiplying it by 3, and that's how the federal poverty is determined and still used today. And as this is the day of fact checking, you can, after this presentation, go on Google and do some research, which was something interesting that I've learned. And so what happens is that the federal poverty level, it is not adjusted to reflect the cost of living differences across the U.S., except Alaska and Hawaii. And what that means is that in 2018, it was like $25,000 for federal poverty level for a household of 4, no matter if they lived in Spokane, Seattle, New York City. The 100% federal poverty is the same in 48 states. And so that does create a little bit of challenge. And so here's where the ALICE framework provides a slightly different take on this. And the first thing that the ALICE framework provides is this ALICE monthly household survival budget. So the one I'm showing you right now is for Spokane County for 2018. Number 1 is it introduces different types of households that are available. So you can see in that box, number 1 is there's a single adult, there's 2 adults and 2 kids in childcare, and on and on. Number 2, rather than multiplying the minimally nutritious food plan, the ALICE household survival budget, which is minimal cost, it introduces different spending categories: housing, childcare, food, transportation, healthcare, technology, miscellaneous, and taxes. And so all of these, there is a methodology explained what does that include. But let's take a look at housing. For a single adult, indicates $553 per month. What this budget strives for is for housing to be no more than 30% of monthly budget. We do know that in 2018, those who were renting, 48% were paying more than 30%. So this budget right now it's very core, very basic. And you look at childcare, you look at food, other things. And so at the bottom there, it does provide monthly total, annual total, and hourly wages needed to support that type of household. So what happens is when we compare the federal poverty level to the household survival budget, which is very core, on a monthly basis, we can see that for one person, it's $1,000, $11, but when we consider the survival budget, it's higher. When we talk about a household of 4 and a household that has 2 kids in childcare, that is just more than doubles when we incorporate the cost of living. So how has the number of ALICE households changed over time? We can go back and look at 2010. And what I want you to think about here is that this chart here at the bottom there, the dark blue, it talks about households living in 100% federal poverty level, which is 25,000 if a household of 4. But then we take a look at the next category of top set of households, those are ALICE, which they are struggling to meet the household survival budget. And looking at 2014, there were 74,000 of households that were either poverty or ALICE. And 2018, that's the data that we have for the latest data, is we have poverty and ALICE still kind of staying around 72,000 households. The good news here is we can see that those households living above ALICE and above poverty is growing in our community, which is a good sign. And at the same time, there are still households that are struggling in our communities to meet that basic household survival budget. So as we think about ALICE households and as we think about who is struggling in our community, in 2018, we had 13% of households living in federal poverty, the 100%. We had another 22% struggling to meet that household survival budget. And then the rest, 65%, generally doing well in our community. When we look at ALICE household breakdown by race and ethnicity, we get also a different picture. So for American Indian, Alaskan Native, the likelihood of them living in poverty or ALICE, it's much higher, and in similar ways for Black households. And we do see that in different kind of data sets and with different explanations, but the data is there. And for us to think about our communities who call Spokane County their home and what's their experience here. So I do just want to briefly touch a little bit on COVID-19 and ALICE. Unfortunately, the last data is available for 2018. But there are other reports that are coming in the United States that possibly just provide more insight to what is happening. So recently, NPR and Harvard and Robert Wood Johnson Foundation did a study, and they found that 46% of U.S. households are reporting facing serious financial problems. So what are those problems? It's depleting household savings, difficulty paying credit card bills, paying mortgage rent, paying utilities, affording food, affording medical care, making car payments. All of those things are financial problems faced not only by those living in poverty, but also those living as we consider ALICE. And as we know that 35% of folks are living either in poverty or ALICE. The other resource that I wanted to highlight for you is by Opportunity Insights. It's not part of ALICE, but it does provide an image in percent change in employment. So the bottom blue line is for low-wage workers earning less than $27,000, and then middle-wage worker and high-wage workers. And so this is for Washington State. I'm sure you've seen some of this data, but you can see the disproportionate impact. So October 1st, low-wage workers were still 11% down. And so some of these resources related to COVID and ALICE can be found on the United Way ALICE website. And so the website is unitedforalice.org, and there is a specific section of COVID-19 resources. And you can see reports related to housing, food, healthcare, as there are so much in our community of reports on that. So as I come to conclusion, I do want to just, again, share thanks for the partnership that we have in the community with Spokane County and with all of you. But I do also want to remind you that the Spokane County United Way, we use ALICE report to inform our work and inform and drive our work in our community. So we invest in local nonprofits that are serving ALICE households. We believe that building financial stability and resilience is great and is much needed for ALICE households as they continue to build their wealth. And we use this report to inform our work. Part of that is we do provide funding to the Eastern Washington 211 as a resource for information about health and human services. In the last 365 days, there were more than 19,000 calls received by 211 as they connect folks to resources. 211, as funded by United Way, has live data available. So since March 1st, there were more than 16,000 requests made to 211, and as they continue to connect folks with in our community. So this report can be found on unitedforalice.org. At this point, I will turn back to Tim. I will attempt to stop sharing my screen. And also, I do want to thank our sponsors, which we also have local sponsors that sponsored this report, Vista, Providence, WCECU. That this report is made possible in 3 states, Washington, Oregon, and Idaho, available for each county. And if you go on unitedwayforalice.org, you can drill down to zip code. This data is available. So I will share the screen, stop sharing the screen now. And Tim, back to you.
Yeah. Andre, thank you. And honestly, if there are any of you that have questions, we're happy to answer those here today. I know you have lots of things on your agenda, but we're happy to share any information that we might have around this. More importantly, we're more than happy to make this kind of presentation or something similar to it to other groups that you're involved with. Again, the point here is that this is information that hopefully all of us can use to help better shape decisions and choices that we're having to make with all of our different investments and engagements together. So questions that anyone might have or observations about the report?
This is Arian Schmidt. I just want to say something on the Alice page that you'll receive. There's a little icon that says "Take the Alice Challenge." It is a impactful kind of a venue that whether it's you personally or sharing with colleagues or even students, just kind of puts you in first person about what some of the folks in our community that you might not have even thought about are having to make decisions on. And I think that's actually almost as powerful in a personal aspect as the report itself. So whether we include it out to our employees or, send it on to some of the schools, it really helps you understand what some people are dealing with that might not even cross our mind.
Ariane, thank you. That's great. And that's on our site. And it is, again, an excellent way to kind of bring the data to life. Spend 20 minutes, if less than that, to just go through that experience, if you will, and the choices that you have to make. And candidly, that is part of the presentation that Andre has put together, that we can build that into an exercise, if you will, with any of the groups that you might be interested in presenting this to.
Any other questions? I know that I can definitely speak to just, anecdotally what I'm hearing here at the health district, that a lot of the stories that we hear from families align with the data, right? It's folks that reach out to us for help who meet a lot of the criteria and information that Andre just presented on. So I think it's very, very impactful information, and that the 20-minute activity is really eye-opening if you've not ever done that before. Any questions? I'm looking over in the chat. I don't see anything. I know Tim and Andre are both always accessible at United Way if you have questions. So thank you so much for being with us this morning and presenting. We appreciate that. So thank you.
Appreciate the time. Thank you.
Thank you.
Thank you. So I want to move here on the agenda, and before we go into GSI, Ray, are you ready to report out on the business technical advisors?
Yeah, I can give an update.
Thank you.
So there were some questions. This is just going to be a high level update on the BTAs and kind of what they do. So right now we have hired 4 business technical advisors. Originally, they were twofold. One, consulting with businesses on what they needed to do, and then secondly, helping to assist with disease investigation, outbreaks, and that kind of thing. Since we've seen the rise in cases, we now have shifted primarily to just contacting the highest risk facilities, and those are ones that typically right now either have an outbreak going on in their facility, or we're starting to see numbers rise in which we feel is going to lead to an outbreak. What we're doing with those is a business technical advisor will contact somebody from within the business. They'll have a lead and they'll guide them through the process, what they need to do to clean the facilities, isolate the individuals, how they contact us if they have possible cases and whatnot. We have, because of the rising cases, I have reassigned two additional staff to that. So we've got a total of about 5 FTEs right now assigned to that. One of the questions that we had is are we seeing certain segments within the business community that we're seeing higher rates? And we're really not. It's just all the way across all sectors of business. I think there's more focus sometimes on the restaurants, but that's simply because we have so many restaurants in our area versus other sectors of the community. So we're really not seeing a higher rate there. But we are definitely seeing cases, and that could be customers, it could be workers, it could be owners. So it's all across the sectors. A few of the things that we're working on, again, I mentioned that right now we are prioritizing. We have low, medium, and high risk. We are focusing only on high risk. The medium and low, if we can, we are contacting them, but we are trying to get resources out to them. It's more hard copy documents that help to guide them through that process. They're also working on, there's a local attorney that's been working with about 600 businesses here in the Spokane County. We will be having a meeting coming up in the next couple of weeks, doing a short presentation of kind of the stuff that I just detailed to you, and then answering questions, getting questions and answers out there. And that might be something that we reach out to GSI on to help get that word out, maybe to get to promote that and get more businesses involved in that. And then we're also going to try and attempt to record that session so that we can post it to our website and to some of the other websites, make that available to businesses. We also just created an FAQ. There's about 10, 15 questions on there, delve into anything from, how long does an employee need to be out of work once they've been exposed? What is the definition of an essential worker? What do we need to do to clean? What chemicals? Just simple questions that we get all the time. Once we get that finalized, again, that will be posted to our website, and we'll probably be reaching out to some of the other agencies to help to distribute that to the other businesses out there. So I think that's just a kind of a recap of where we're at. As Steve mentioned, we currently, where we're sitting, we've had over 3,500 business contacts so far, which is a pretty high number. So we're starting to hit a very large percentage of our businesses within the county. So before this is all over, everybody probably will have some kind of an exposure out there. So with that, I can answer any questions that people might have. All right, and if you do have questions, feel free to reach out to us. We can get those answered. Thanks, everybody.
Thank you, Ray. Tiffany, or actually, because we just did businesses, is anyone on from GSI? I don't think I see anyone. Okay. Tiffany, do you want to report out?
Sure. So good morning. My name is Tiffany Turner, and I currently serve as the Operations Section Chief here at Spokane Regional Health District, and going to give you a quick summary on some of the operational areas that we've been working in, some successes and challenges that we've been having. As Ray had mentioned, pretty much all the areas are working hard at trying to find better efficiencies and trying to triage with the increase in cases that Steve explained. And so that includes the business technical advisor area, care coordination, as well as the case investigation and contact tracing areas. So again, trying to find ways to streamline processes, find other partners that can help us out. One of the things that has come out that some of you may have heard of and may have actually received a notification on your phone was the new statewide exposure notification tool. That's hopefully going to help us out with some of that contact tracing and exposures. It's called WAD Notify, and what it is, it's an anonymous app that's available in 29 different languages. And what happens is when a user downloads that app, they are alerted when they spend time with anyone that also has downloaded the app that ends up testing positive for COVID-19. So it's a pretty neat tool. It's again, totally anonymous. It doesn't collect or reveal locations or personal data. It simply tracks where people are at, and then alerts those that have been in close contact with someone, again, that inputs that they have tested positive. So as of yesterday, we've actually already registered over 200,000 people in Washington State. So of course, it's only as good as people that register. So we're really encouraging people to register in that system. As Stephen mentioned, we are currently struggling with outbreaks in a lot of our congregate care facilities, which includes about 5 of our shelters. Shelter testing, we've increased the testing to 7 days a week now, and we have a large cache of tests here. But the struggle is having staffing to be able to conduct that testing on 7 days a week, and so we've entered into some contracts with some mobile testing agencies to increase our testing capacity. We've also partnered with different healthcare agencies, Multicare, Providence, the VA, to help with what we call drop teams into some of these congregate facilities to help manage those outbreaks. We are also training some of our public health nurses and our caseworkers to also be able to test and triage in some of these shelters. So really taking a lot of steps to try and manage these outbreaks in the shelters. One area that maybe this group can help us with is we are noticing a lack of PPE adherence and infection control measures in some of the shelters. So would appreciate any help or support that you guys can give to shelter operators to help stay up with those regulations and standards to help us reduce those outbreaks in the shelters. One other area, as Stephen mentioned, with the increase in cases, we've seen an increase in our isolation facility services. So again, working with the different shelters to try and triage, and as we test people that are positive, sending them to those isolation facilities. So our capacity continues to increase, and we're looking at other options for isolation facilities if we should need those in the future, if we extend our current capacity. One of the things that we are trying to do is work with the shelters, particularly with Union Gospel Mission, because they do have nursing staff on site there. And so hopefully trying to work with them to see if we can get their nursing staff to help us with testing and isolation and quarantine within their facility would really help us out a lot. And so again, any support that you guys can give there would be appreciated. So hopefully that'll help us manage the outbreaks. We are still struggling with transportation issues amongst the isolation facilities and shelters and getting people in isolation to their medical appointments. So again, we're looking at different contracts with some transportation agencies that are able to get them to certain medical appointments. We are in working with STA, and they have graciously provided some vans that they're making available for transportation. So our next step is finding drivers to be able to drive those vans. And so we are currently looking at entering into a contract with Guardians to provide transportation services from isolation facilities into shelters back and forth. And so right now we're looking at needing transportation coordinators, and Sarah has been doing a great job in trying to find some resources for us there. But if anyone knows of other people or agencies that might be able to assist us with that transportation coordination piece, let us know. And then one last piece, vaccine. You've heard that Pfizer is getting close to hopefully being approved. And if they are approved, then we in Washington State expect to receive about 62,000 plus doses in Washington State, and hopefully up to 200,000 from Pfizer by the end of the year. You probably heard, I think, reports from Lindia in regards to who's going to be receiving those doses. So those doses will be shipped to hospitals and healthcare facilities that have registered to be vaccine providers. And currently in Washington State, we have 54 providers that are fully registered. We have a lot more that are in the process of being registered, but aren't fully registered yet. So hopefully we'll get more providers registered to be able to receive vaccine. And of course, that those initial doses are going to be going to the high-risk healthcare workers. But of course, we have a lot more healthcare workers in our state than we have doses for. So conversations are happening about triaging and prioritizing those healthcare workers. So, but good news on that front, that looks like vaccine is coming soon, and we can start administering those by the end of the year. And that's the end of my report.
Thank you, Tiffany. Any questions for Tiffany? Okay, before we move to just open discussion to talk about general things. Yeah.
So I did have a question with regard to the app, the tracking app. So I know yesterday when I got up, it kept trying to automatically load on my phone as I was trying to do other stuff. So, but what I'm curious of is how does it track when somebody's tested positive? So if I test positive, do I have to go in the app and indicate that I tested positive so then it can work its magic? Or does public health flag an individual? How does that work?
Yeah, no, it actually, my understanding is that it's populated from, I want to say, the National Association of Labs. So all of the information goes into there, and I can send the group, because the state just sent us some infographics on how it works, because I know a lot of individuals have had concerns about, like, if there's HIPAA information or other information that gets loaded along with it. But in the infographic, it kind of explains like how it works and then how it processes off and onto the app. So I will go through here. I can send it out to this group because the infographic was really good with it.
Okay. I mean, I give them credit for how aggressively they pushed it out yesterday. Like say the fact that I didn't go seek it out and it was trying to auto load on my phone, I thought was interesting. But I was concerned that if it relied on individuals then to go self-report, that we would have a huge under-reporting going on.
Yeah, no, and I don't, Tiffany, do you have anything else to add on there? Oh, I wonder.
The only thing I know that public health is, they're looking at public health to assign a PIN number to any positive cases. So it looks like they'll take that information from our database of positive cases and link it to that database.
Yeah, and I will send, you have to have, it does use Bluetooth. I don't know why I cannot pull this up. I don't know if I have too many things open. But the fact sheets, I'll give it to Arian to send out, or to include. There's also going to be lots of ads. If you haven't seen those I think will start, actually today, December 1st, to get it out there, to try to get people and to kind of get through some of the myths about if HIPAA information or other protected information is being sent out with it. So that kind of actually segues to communications, unless there are other questions on that.
Amelia, this is Arian. I found the fact sheet, so I'll include that in the notes. And then if you have a more robust slide deck, we can include that later.
Okay, thank you. I think I have too many screens open. That's probably like a metaphor for life in some way, but anyway. So for communications, and I know this will be something that Kelly and her team start getting out there, related to the positive test, but we now have a script for the Community Psa that we talked about at our last meeting, related to thanking the workers who are working on the front line. We have a lot of partners who are going to be with us when we video the PSA. EMT, the Sheriff's Department, Spokane Police Department, Multicare, Providence, a lot of the folks who have been working on the response for a long time. So I think that'll be nice. It's going to kind of be with us through the holiday season, and kind of more of that message of hope of what we can do versus what we can't do because of the pandemic. Some other things to be watching for in terms of communication is that Lamar and Emerald billboards have given some in-kind space, and we're actually going to be promoting mental health assistance. That's going to be what we focus on, the messages that are focused on the billboards. The vaccine messaging, we are working with the CDC and the DOH communication plans to make sure that we stay consistent in getting that information out as the vaccine planning goes on. And then last week we had the Facebook Live participants included Providence and Multicare to talk about hospital capacity, because that's been something we've been getting a lot of questions on. And then this week, we're really going to do some more work on the Facebook Lives with disease investigation and contact tracing. And then our updated website for the COVID-19 pages will be updated to include the Washington Notify program. So that concludes everything that I have that we needed to report out on. But just wanted to open it up for discussion if there are questions or things that folks need answers on.
Hey, Amelia, I was just hoping, could I share a little thing about what we're working on at the city?
Sure, go ahead.
So Tiffany covered a lot of the work that we're working on, but I just want to share with this group that there have been some projects that have come up that are requiring a lot of attention, a lot of work, and kind of catalyzing us to maybe encourage a partial reactivation of the ECC. And so what we're working on right now is, things like the isolation expansion, things like that. We were reached out to, DEM kicked a request down to us that came in from Chaz, who's opening up a remote testing site at the arena for December through April. And they're looking for 5 to 10 traffic controllers and parking assistants. So I vetted out through the city where we're reaching out to co-ads and volunteers, trying to see what we can do. But as these requests come through as us as the lowest jurisdiction, as we can't meet them and some of this work is going to need more work group and time attention, we'll probably be asking to consider reopening or partially activating the ECC to help with some of this work. So just wanted to give this group some insight into that, and I'll bring more details next week on that.
Thank you, Sarah. I know one of the things, we're all starting to hit is figuring out, we've only got so many people that can help us, even in terms of our volunteers in different places. So yeah, it's
100%.
getting hard to manage. Todd.
That's what I think that
Yeah. So
if we eventually.
So I don't know if there's someone from the county that can speak to this, because I believe that Chaz went before the county commissioners and asked for assistance in the last couple of weeks to assist with that matter. So I don't know what that assistance looked like or if it was granted, but I think one of the things we could probably look at as an example is Second Harvest has continued to do some pretty substantial food distributions in this community, and I know they have found a way to manage traffic and deal with some of that other stuff. So we should probably be looking at them to find out how they're addressing it. I think they lead by example, and so it's probably a good example for other organizations that are trying to set up significant, I'll just say, distributions. In this case, testing. So I don't know if it's a distribution, but it might be a similar approach.
Absolutely. I'll definitely vet that out. And Todd, for the record, this came from your department to me because we're the lowest jurisdiction. So when they went to the county commissioners and to DEM said, oh, wait, we're the level up. You go to the city, they'll see if they can help you. If they can't, it'll get kicked up to us. So I don't know what happened there, but it's on my plate right now. And if we can't make it work, then I'll kick it back up and we'll reach out to the state together for some help on it.
Okay. Yeah, because I know Second Harvest, I think they build some of those issues into their budget. So when they go after grants and private contributions, then they budget for it. What I don't know is, I don't know if Chaz received a financial support from Spokane County. If they did, I would like to believe that they thought through kind of all the logistical issues and figured out what they needed to cover. So
my understanding is it was just for rent.
Yeah, so.
I'm sorry. Go ahead, Commissioner Cooney.
That's okay. So yes, so it was just they just asked for the rent for the facility for, I think December 6th through December 30th. So that's what the CARES dollars were, taking care of the rent for the arena parking lot and in some of the interior space.
Todd, would you be willing to do an intro email to Jason Clark and include Sarah and the health district and obviously Chandra, particularly for this, and just say, hey, what have you learned that's worked well between a volunteer and, budgeted environment? That might help Sarah just take advantage of what's been done rather than recreating the wheel.
yeah, absolutely. I can do that. I know that, everybody's trying to do their part and help wherever they can. Sometimes we really have to be thoughtful about all the logistics that goes into these, because sometimes they get into what they want to do and realize there are things that were not considered. And it's not as if other entities have the resources to donate, because that's typically, I think, the expectation is if they don't have the resources, they expect others to provide it at no cost. And I think there's a lot of entities that are, after an extended period of time, are getting tapped out and don't have reserves to go to.
And I can also share that as part of the testing group that we have going on here at the health district, Chaz has been a part of that. And I know that they've also been in conversations with Providence and Multicare. So they're not just doing this on their own. They do have community partners that are helping them. And I know we've provided some support in terms of stanchions and other things that they need to set up the site safely and carefully. So I think a lot of that's going on. I think they did mention in our last conversation about it that they had put in the staffing request, because I think it's kind of to the point where there aren't a lot of other volunteers to just go around, right? So. Was that all, Sarah? Did you have other things?
Yeah, that's all for now. It's just an ongoing, we'll just keep churning along.
Yep.
Thank you.
Anyone else?
Could I just say, just comment on something? Today is World AIDS Day 2020. And I started my clinical career in the middle of that epidemic. So, and if you fast forward to today, with the advances in science, therapeutics, prevention, it is a chronic disease as opposed to a death sentence as it used to be early on. So the reason why I bring that up is because I am very encouraged by the same diligence and commitment from scientists, clinicians, researchers that is being applied to COVID. And the progress we've made is incredible comparing to the progress we've made, 30 years ago when we didn't have as many tools as we do now. So I'm very encouraged by what I see, and I am confident that we will conquer this particular disease the same way we conquer some others. So I just wanted to bring that up because I do want to say thank you to all of the folks that have participated in epidemics and pandemics before and have brought us to today and giving us the tools and the building blocks to do what we do today. So I just wanted to bring that up.
Thank you. Any other or final questions, thoughts, agenda items for next time that anyone has? All right. Well, thank you, everyone. You know how to reach us if things come up or that you want us to add in to the agenda for next week. And we will see everyone next week at the same time. Thank you.